Now to the Ebola outbreak. A healthcare worker who just returned to the U.S. from the West African nation of Sierra Leone is now in quarantine at a Newark, New Jersey hospital. The woman told screeners at Newark Liberty Airport Friday she had been caring for Ebola patients in West Africa. Guards are now blocking the hospital entrance. The woman did come down with a fever, but in a preliminary test, she tested negative for the disease. She will remain in quarantine. This comes after the governors of New York and New Jersey ordered new isolation measures for passengers flying into those states from West Africa if they've had any contact with an Ebola patient. A New York City doctor who returned home after treating Ebola victims in Guinea raised alarm this week when he contracted the disease. Jerika Duncan is at Bellevue Hospital Center here in New York with more. Good morning, Jerika.
Good morning, Benita. Dr. Craig Spencer remains in stable condition here at Bellevue. And yesterday, crews carried away large blue barrels from his apartment building. Health officials say they continue to track the whereabouts of Spencer just days before he came down with a fever and tested positive for Ebola.
On September 18th, Dr. Craig Spencer posted on Facebook that he was off to Guinea with Doctors Without Borders. The 33-year-old worked with Ebola patients there for 3 weeks. Guinea was the first place in West Africa where the outbreak was identified. Spencer left that country on October 14th, traveled to Brussels, and arrived in New York City on October 17th. From that point forward, the doctor self-monitored, taking his temperature twice a day. On Tuesday, the 21st, he started to feel fatigued, but visited friends and traveled throughout the city. He went to a meatball restaurant in downtown Manhattan and had coffee at a popular outdoor park. On Wednesday, the 22nd, he ran 3 miles in his neighborhood and that evening took the subway from his apartment in Harlem to a bowling alley in Brooklyn. After bowling with his fiancée and 2 friends, he then took an Uber car service home. The next morning, between 10 and 11 a.m., Spencer developed a fever of 100.3 and contacted health officials. Thursday afternoon, ambulance crews rushed him to Bellevue Hospital, a scene captured by the New York Post. The hospital is a designated Ebola treatment center. New York City Mayor Bill de Blasio.
From the moment the call came in, the process proceeded exactly as dictated, interviewing the patient, getting the facts, having an EMS team that was specially trained, receive the patient, the handoff at Bellevue as the training dictated.
Health officials are in the process of testing and decontaminating the doctor's apartment. In this congested city of 8 million people, New Yorkers are trying to heed to the call to remain calm. New York City resident Baruch Reed.
I have faith in the system, in the public health system, to take care of me if I do get it. There's only one patient that's died, and that's pretty clear that that was due to some unfortunate circumstances surrounding his diagnosis. And everybody else in this country, at least, is surviving, and I'm not worried about it at all.
And starting Monday, new national protocols take effect. Anyone traveling into the United States from Sierra Leone, Guinea, or Liberia will have to self-monitor for fever for 21 days, and a healthcare official will be in contact with those travelers daily. Anthony?
Jerika Duncan, thank you, Jerika.